Welcome to this episode of Orthodontics in Interview. It's my absolute pleasure to give you guys Carlos Flores-Mir. So, Carlos is a tenured professor in orthodontics at the University of Alberta in Western Canada. Now, Carlos has spoken extensively on a variety of topics, and the reason why I really wanted to interview him were his recent two topics at the American Association of Orthodontics meeting that took place. And essentially, Carlos presented some incredible cases, but also presented his failures with those cases. And that's really showed insight into clinical practice. And I wanted to have a chat with Carlos about why he did that and what has led him to be this mammoth academic within our field of orthodontics, yet still feels comfortable to present his failures. So more about Carlos. There's so much to say. So Carlos is an associate editor at the Journal of World Federation of Orthodontists. He's an assistant editor at the Angle Orthodontic Journal. He works in private practice in Edmonton in Canada as well. Originally from Peru, where he did his dental degrees and his orthodontic degree, and then he shifted to Canada in Alberta, where he's now part of the faculty there. He's published on the most incredible number of topics. And I was talking to Carlos earlier on and stating that with my blog, it's impossible to write a topic without seeing his name in it. It's almost frustrating. Carlos has published over 350 papers. That's when I gave up counting, and 8 book chapters. Carlos, welcome to the Orthodontics Interview podcast.
Thanks a lot, Farouk. Thanks a lot for the nice, kind words.
So Carlos at the moment actually isn't in Alberta in Canada. He's actually on a sabbatical in Naples. So Carlos, what's led you to be in Naples in Italy at this point in time?
Well, it's actually 6 months. Although I had the right to take a sabbatical for the last 13 years, I never saw the opportunity. And then we're going to talk about family probably later. But part of that decision was that it was very hard to live with my wife and the kids for longest period of time because of that. And so my oldest one is turned 18. She can take care of the youngest one that's 15, and so I can travel with my wife a little more. And so it's the timing is more related to the family and the possibility to now travel with my wife without necessarily having to travel with my kids. They're coming. Uh, when we were to talk about my lectures on the AO, part of the behind the scenes reason for I'm doing this is a couple of years ago I had a very challenging situation in practice, not at school, in practice, which my brain did a big mess of it, which at the end of the day didn't have any reason why to. And so when I started thinking about that, I was actually going to some mental health issues, right, to try to solve the problem in practice. And then these things you cannot decide overnight, right? These take planning, get the authorization for the system. But anyway, family, and also I could have used a break. When finally I was able to get it approved and everything, my situation in practice was solved. And so to no significant problem whatsoever. And then I was just ready to go and then was not turning back. The 6 months is because I'm actually scared about stop doing what I've been doing for the last 20 years for a long period of time. And I'm just enjoying my first 3 weeks and I may stay for longer here, but that's a little bit of, and Naples because research collaboration, right? And so Leticia Perillo, you will see, I have a few papers with her and I've been in Naples twice. And I just wanted something close to the ocean. But then at the same time, academically, it's not a holiday. I have to do research. And so this was a place I knew from advance. It's not a typical place to come, but it's sometimes my decisions are not based on the typical. This is what I feel doing. I'm really enjoying my time here.
And that really, Carlos, is the next question I wanted to ask is that, and you may have already answered it, but you've written on such a vast variety of topics within orthodontics. As I've stated, it's almost impossible to come across a topic you haven't written on: self-ligating brackets, CBCTs, diagnosis, looking at blood markers. I mean, these are seemingly unrelated topics within the field of orthodontics. How have you come across those topics that you've researched enough to publish on? What's led you down these very different directions in the field of orthodontics?
I think that probably most of my research is related to obviously the academic environment and University of Alberta. We do not give the students a topic, right, of research. They decide what they want to, and then normally they will follow to some degree what we've done before, but there's no indication for them to do. And so that explains to some degree, the student will tell me, I'm interested to explore this. Okay, let's sit together, we discuss. And so that's a little bit of how then it goes from one side to the other side. I have a lot of international collaboration, right? And then in a lot of the systematic reviews, I am an author. I provided the expertise in the review part, right? And then they will pick up the topic, and then if I found it too interesting for me, then I will join and participate, right? And what's interesting with that is I do actually participate strongly in the process. It's just not only giving indications. I go through the paper, I read everything, we go together. So it takes time. It's just not simply adding a name for sure.
And that is evident because you've also won a vast number of awards in your career so far, but probably one of the most notable awards that you've had relates to education. And I think it's endemic that you're able to publish and inspire people as a result of it. You've won the Gibbs Teaching Scholar Award in 2010, but also the Canadian Faculty of Dentistry has also celebrated your teaching abilities. So you are an inspiration, and I want to kind of explore that a little bit further with yourself as we go through this interview. But I want to kind of come back to the other side of your
Yes.
high academic output and achievements, is that you also have two wonderful daughters, and Alexia is your wife. How have you managed to have such a committed academic career and also managed with the family? How did that work for you? How did you obtain that balance?
Because of my wife. Uh, as simple as that. A lot of my capability to invest so much time and effort in my personal life has come at the cost of her personal professional life, and that was a decision made by us together. We moved to Canada for a year, and then we stay for now 20 years. And at a certain point, we decided to have family. And then in a conversation, she really, really wanted to be a mother, and then spend the time with the happened to be two daughters. And so it's we've been able to. I've been lucky that my university salary had been significant enough that I could only one of the two work, and then she and I indirectly have enjoyed raising the kid day like 24 hours a day with them. And so that's something that she will not change at all, right? We are now in the stage in her life that I am discussing with her that it's time for her to retake her professional career as much as she can. It's not easy, but it's not no regret what she did. And I'm really, really proud about the character and of my daughters, and a lot of that is her being with them and then me around. But university academic life gives you flexibility, and so I've been able to be there when needed. Uh, Sometimes take the afternoon off and then come back and work in the evening. So it's balance is a very difficult thing to attain. Actually, I don't think we ever get into balance. We are above or below whatever is your balance, right? And then, but balance in
No
life
doubt.
is it's defined by each couple. So I guess as far as I understand, then she's proud about me. I'm proud about her, and we have different career paths, obviously, right? And then it's time now that I will spend more time with her too, right? And I'm actually start looking forward to travel. And after Naples, I'm going to spend 3 weeks in Spain with my wife. Amazingly, she decided that's okay to leave the two girls, I say like my daughters, alone for 3 weeks in Canada, but I think that's part of maturity, right? And then we'll go to Australia for another 2 weeks and a half. And so maybe that explains. It's I do research. I will do research in these visits, but then at the same time, it's finally time to spend, give my wife some time that I took away because of my profession, right?
Yeah, that's so interesting, Carlos, and it's probably endemic of people who are successful, is that there is a support which is not only matching their excellence but perhaps even exceeding it. And you've kind of celebrated not only your wife's dedication but her brilliance. And that's funny because part of this interview is celebrating your brilliance, but it's interesting to have that arrangement that actually there's somebody else who is equally, if not more, brilliant in the background. And I'm really happy for you and Alexa. So, Carlos, as I've mentioned in the introduction, is that part of the reason why I wanted to interview was about your lecture topics at the AAO. So, guys, if you haven't heard it, we've done some podcasts on it previously. So, 2021, Carlos came up with the title, When You Play the Game of Thrones, You Win or You Die. Is there a middle ground? And in the recent AAO that took place, it's most men would rather deny a hard truth than face it. And I'm just going to give you guys a very brief outlook on what these lectures were. Essentially, there are descriptions of cases cases that Carlos had treated or been involved with that had gone wrong to some degree, either in a clinical outcome or in decision making, or patients didn't like what's taking place at the end. So Carlos stood up there on what is arguably the biggest stage within orthodontics and presented a failure of some kind. Carlos, we don't see those types of lectures happening, especially with the academic and the clinical reflection and critique that you gave. Why did you choose to do that first? And two, were you nervous how it was going to be received when mostly we're seeing excellent cases of new ideas?
Because I think we do reach to some degree of professional growth, right? And then I think I do it because I remember finishing ortho school and I was a good student and probably not brilliant clinically, but like everybody, you go out and then you start treating your cases and then you go to the meetings and then everybody seems to do extraordinary things and then you go back home and then you realize all my cases, nothing is really not even close to there. And
Oh
that was
God.
very hard on me because then again, we are, most of us are high achievers and that's the reason we go all the way to dentistry and eventually orthodontics. So it's not. So it took me a while to actually be able to do what I think we should be doing, which is actually have conversations about what does not work and how to get out of the problems. And so was I nervous? Especially, I remember before this year, right? Because then I was there, and then I know those cases. I know the stories of each one of those 21 cases, right? But then I said, you know what? Let's do it. And so at a certain point, I put the topics too late to back up, standard. Actually, I was quite happy because historically one of my problems is I speak every day Spanish, Portuguese, English, like here and there, and so I in my early presentations I tried to cover too much material, speaking too fast, and my accent didn't help. And so actually for me was actually it's amazing feeling when I completed because
Uh-huh.
I thought it was one of my best presentations from the point of view of time management, flow of ideas, points I wanted to communicate, finish before time. And so I finished basically with a sense of relief of a personal goal to be accomplished. That's why I reflect back. The cases, I know the cases. I know everybody has cases like those. So I was less concerned with that because I can't stand. And if somebody tells me I don't have those ones, I know it's not true. We all have them, right? And I where I am now is more, and that's changing my research is more into try to better understand my patients, what they expect. And my struggle now is more or less with I struggle with this because and I was lecturing today in Naples the same was talking with the students like I need to try to educate my students to try to get the best possible result. But the more I go in this route of trying to understand my patients, the more I realize that their goal is reached way before our goal. And after that, it's not fair for the patient to continue a journey that is not doesn't really provide a benefit for like that we can demonstrate to the patient. So I'm struggling with that. I'm struggling with the concept that at certain point I know I can do better, like, but the patient doesn't want me to continue. And I think that's where I am now. And so then I think I came into a personal equilibrium, which is when I get into a situation that I think it's reasonable, not perfect, reasonable compared to the start. I am open the conversation with my patients about okay, we can talk now about an endpoint. This is what I can still do. This is likely the time it will take. Do you want to go for it or not? And if the patient tells me that's it, I'm wrapping up the case, couple of finishing, I'm out, and that's fine. I think that the more I explore research patients, the more I realize how divergent our goals and the patient's goals, and that's the patient related outcomes. That's kind of where really we should be putting our effort.
That's so interesting. It's that we talk about evidence-based practice, but it's that third component that those patient factors that kind of gets washed away when we start talking about
Yeah.
clinical biomechanics, and we start talking about what does the research say about this, and that third kind of component starts to disappear. It's interesting you gravitate back to it. But I've got to tell everybody how last year you presented this incredible class 3 case at the AAO where you used plates, mini screws, you had protraction, you had all sorts going on. And their patient at the end had an incredible result. But you turned around at the end of that lecture and said that the patient would have preferred orthodontic surgery over a shorter period of time. And I thought, wow, you not only asked off yourself clinically so much, but actually you were confident enough to stand on this bigger stage and talk about how you made an incorrect decision according to that particular patient. And I was blown away. And you talk about what you felt were your successes in that particular presentation. But for me, what I took from it as a listener was your excellence in critique and a continual process of critique, not for just the clinical and the academic, which you presented brilliantly, but it was also for the human aspect, the patient interaction as a clinician. What's my patient thought about this? Have I critiqued it? Have I re-asked them the question again? And I was blown away by that. Really, I was. Because when I get a good clinical result, I just want to take my photos and then
No,
end the
no.
conversation. But you didn't do that. You asked the patient. And I thought it was really
Uh, and,
profound.
and something that I'm starting to lecture is about the concept of mature minor, and that's something that legally it has a stand in Canada, right? Which is that 12, 13, 14-year old that doesn't want to do what the parents want to. And so then the complexity of that process, because we should not provide care for a patient that does not want it. And sorry, a 13, 14-year-old can easily participate in a decision about their mouth and the goals and expectations. It's just I'm trying to mastering my skills about how to put that conversation on the parents and the student and the patients, and then ask them to come after 1 or 2 weeks with a decision or further conversation. Don't rush into treatment, because it will become very difficult then if things don't work well, and sometimes things don't work well, then to have a patient to tell you, you know what, I told you I didn't want treatment. And so that's very easy for a lawyer then to turn around as a problem, a significant problem in providing care.
So, Carlos, I wanted to ask you a question about class two, a topic that you've written about extensively. And we have these two kind of diametrically opposing camps. We've got Kevin O'Brien, who's published extensively both randomized controlled trials and systematic reviews, and it essentially coined the term "we don't grow mandibles" as part of functional appliance correction. And then on the other side, we've got Franchi and the studies that have taken place there, was celebrated at the AAO last year in the Saltzman lecture in 2021, essentially describing how we can get significant mandibular growth with class 2 correction using functional appliances of up to 5 millimeters. Now, and I appreciate you've written on the topic as well, but we still have this question that seems like it remains within our profession. Where do you stand on it? Can we grow mandibles in the right patient? Is it still just wishful thinking?
I think the way I explain my personal opinion about this is, let's start with the degree of skeletal discrepancy. So if I have a severe class 2, it does not matter. Whatever we're going to do, you're not going to move that patient from a severe class 2 that should get surgery to a non-surgical case. So that for me now in my professional experience is, sorry, I don't feel comfortable trying, because from 10 to 8 to 7 to 6, what is the real benefit for the patient once you consider the cost? And actually, as we discussed, that adolescent, that child getting tired of a treatment that a lot of times they don't care. So I think that the struggle for us is probably the moderate, because the mild, then those 2, 3, 4 millimeters, depending on the technique and the involvement of the patient, it's a reasonable goal that we can go from a mild class 2 skeletal to a close to class 1, no reason to think about the surgery. And so it's the moderate, which is always that camouflage situation, right? And from my point of view, we tend to forget that if we are camouflaging, we are not supposed to get out of all of our goals. Something has to give it. So, in other words, what I'm learning is, well, maybe that remaining overjet of 4 millimeters, it is like you should not keep going for another year to get what? Reality is you are camouflage enough. And so I'm learning. That's one way to answer. The other way I do is this whole conversation about lower incisor. For me, I was trained with a 95 degrees, or I was 90, I moved to 95, probably something like that. But for me nowadays is that what is the initial value I have before I start? That is stable. Nature set it up as stable. I'm talking about a skeletal class 2 or class 3. So now the question is how much more wiggle room I have. And so if I start with 100 or 102 and I go to 105, because that's typical of a class 2 correction, 3 degrees, 4, I'm fine with it. It's not 90 to 104. It's basically the difference between the initial and the final. That's the number that I'm looking forward, more than the value going back to there, because it's a camouflage case. If I'm doing surgical case, I then should be able to put the orange incisors in that 90-95 range.
So your kind of your limits are the amount of camouflage that you're willing to do for that patient. That's
Right.
interesting.
And I reflect in my conversation with patients that sometimes we keep going with elastics for after a certain amount of time with a class 2 corrector. If things don't improve further, I'm learning like, that's it. That's the biological limit. Let's stop, reassess, change treatment plan, call it a day, life goes on.
Carlos, switching back to life, what
Yeah.
kind of things does Carlos Flores-Mir like to do? What's your hobbies? What do you like to spend your time doing?
Things that drive my wife crazy, too. So because it's
We share the same hobby. We share it. Amazing.
But then, no, the situation is that both of my hobbies take some time away from quality time with them, but I feel like they're also important for me. And we go into some discussions about that, but I still play soccer. Not that I play well. I play in the city league, and so I'm quite proud
Very
about
good.
that. And so I'm actually missing my Friday games, and
Wow.
usually we are, because everybody's in my age. Everybody is actually, we moved from the masters and now in the legends category, so which is more than 45. And so anyway, so I'm quite proud about that. I'm still run a lot. I don't control the ball too well, but I like it. It's it seems that I'm close to retirement because they keep calling me to be the goalie, but I think it's because people, my peers, my soccer buddies ask me, why do you accept to be a goalie? Because I like it. But you get everybody to complain about it. I come from the university. Everybody complains all the time about my work anyway, so this is just continue and die. Anyway, that's funny.
You have the skill set.
Yeah. So I can cope. Like, it's just keep going. Like, it's just my life is a continuum, right?
Yeah.
And then I do watch hockey. So I am now, if I have a soccer game or a hockey game in the TV, sorry, I'm going for the hockey.
Wow.
And which is interesting because I still enjoy playing soccer, but my passion now is hockey, and it's a Canadian thing. It's like, and the problem, according to my wife, is that go back to soccer, because soccer was 2 hours every weekend.
Mm-hmm.
So now hockey is 3 hours every 2 days, and so she is not happy with that.
Wow.
My girls are now 18 and 15, as I explained to you, so they are company. So I think that it was very hard on her when they were really, really, she was tired of, spending time with them, and then wants to spend my time with me and everything. But I think we're getting closer to a balance, right? And so it's a quality time for both. And then we watch TV things together, right, every day.
Mm-hmm.
But again, that the hobbies, those are my hobbies, right? It's just I don't. Most of my peers do run. They try to run half marathons.
Wow.
It's I think I explained the way is I'm really a team player. I don't challenge myself. I like to do something among others and together get to a goal. That's a little bit of a reflection of my personality, right? It's not about me. It's about just everybody getting where we want to get. And that's why maybe I like soccer compared to try to do more like one-to-one sports in which you are trying to get better, But again, as I mentioned, most orthodontists do actually run, and they actually try to challenge themselves to go and then reach goals all the time, right?
Carlos, what's interesting is that I'm reading a book at the moment called Leaders Eat Last by Simon Sinek, and it describes how a true leader is in servitude to the people that they're leading. So the actual the goal of what they're trying to achieve is what the team is wanting to achieve. And I think what you described there is somebody who is, although you may not put yourself into the leadership position, is ultimately a very, very a very capable leader with leadership qualities. That's really interesting to hear and challenge.
No. That's okay. So do I consider myself a leader? And I think from that definition, that discussion we have, yes, I am fine with accepting that leadership. And then I struggle because then initially, you read, the more you read it, you realize, no, it's fine who you are. And then everybody can lead in their way, right?
Yes.
But I was
Yes.
not initially, I struggled with the concept about the expectations of what a leader should be in the academic arena.
Yeah.
And my personal file, like I should not necessarily change, right? I am who I am. And so now I'm in a period of my life that, again, I'm open to learn. I'm academic, so I'm fine with to be corrected. But at the same time, I'm also comfortable with the concept that I am who I am,
Mm-hmm.
right? And I'm not necessarily, if they want me to lead the program, then they want me as I am, not as somebody I am not.
Amazing, and that is that genuine nature that you're putting forwards, which is perhaps why you've achieved this, the accolades in teaching that you have done, because you have to be able to trust the person who's teaching you. You have to be able to trust your leaders, which is why they achieve successes. I think we're understanding as to how you've got to where you have at this point in time and work so collaboratively with so many people. I mean, those 350 publications are not individual endeavors as you've
No.
described it.
Mhm.
It is a collaborative endeavor. Um, Coming back to this kind of conversation about academics, I was having a look into some of the previous work that you've published and some of the interviews that you've done as well, Carlos. And one of the things you described about 10 years ago now was the challenges of academics within orthodontics, how it is a challenging field to attract people into. Now it's 10 years down the line. Do you think we're still in the same position? Is it worse? Is it better? And if it is still a problem, how can we resolve it going forwards? Is it resolvable?
I think that there's very few countries in the world where a person that want to use most of the time to teach is adequately rewarded, right? And so I am lucky that I'm in one of those places in which the salary is quite reasonable, right? And that is an important distinction because then I don't need to go to private practice, right? Because yes, I make more money, but it's not, I don't have to survive. And so I think that the problem with this, the way I reflect is, it's easy to criticize academics because then they seem to be working in practice more than they should. But the reality is that if the university environment does not provide you a minimal set of resources, then you have to, right? You need to survive. And so I think that sadly part of this is the finances, right? In the real life, right? And then I think that the other thing is a little bit of the, I always tell the students and the dental students when they are graduating, right? So do not discard any professional route, right? Actually, working in a hospital as a dentist is not necessarily a bad thing once you understand what's there. So I think that there's specific type of personalities and things that drive people differently, right? And so, uh, could I work for 5 days a week in practice? Yes, certainly I can, right? I'm looking forward to that. Probably not. I do, I spend 50% of my time probably with patients, either in practice or teaching, right? And so I like that part, but I also like my time to reflect, as we say, read things, interact with students about their journey, try to help them. So it's a little bit of everything, right? And that keeps for myself is balance, right? And I do sacrifice a potential significant income, but I have a good income. So at which point maybe I am also interact with people and then peers and everything. And you know what? It's sometimes we don't realize how much we actually make, and then there's what is their actual need to make more, right? Compared to actually enjoy. It's
Hmm.
sometimes I think that we, humanity, not orthodontics in general, right? It's a lot about what else can I get, reach. So
Hmm.
instead of enjoying what you have,
Hmm.
you're dreaming to enjoy something you don't have, and then when you
Mm.
realize that that's too late, right? You don't
Mm.
realize what you have until you lose it.
Hmm. That's really interesting. That's really
But
interesting.
anyway, so I think that it's a challenging time now. I think that in a lot of the countries I do have relationships because of research and everything, and is the it's an oversaturation of faculties of dentistry, right? Too many dentists are being formed, and then there's not a market to reason for everyone. And then I think that what's interesting I'm observing is in those countries with too many dental programs is then the most experienced clinicians, they start teaching, but they don't teach in a university, but actually they develop their own clinical courses. And then they actually are making more money by
Yes.
teaching in the clinical courses than actually treating patients. And sometimes the patients are actually the patients for the clinical course. So I think that there's a lot of interest in the teaching, but that's because as a market, then that's where it is. And so then it actually is a closed circle, because then you actually don't complain if there's a lot of dental programs, because actually that brings you future students for your courses, right? So that's kind of what I see as a new challenge 10 years later, right? Is the fact that most a lot of us are not really worried about the actual market or the need for, but as long as everybody is in this system of interchange of knowledge for money, then it's challenging, right? So the reality, I don't think it's a beautiful profession, right? Dentistry and orthodontics, but at the same time, it's not easy, right? And I think that a lot of us, when we learn or we decide to come into dentistry and orthodontics, we may be those patients that went to an orthodontic office, and then everything you look around looks great, good quality of life, right? But then nobody tells you about having to deal with difficult patients, staff, business of orthodontics, right? I think that's with where we have to do a better training, is into the business, and then patient. Like, it's almost like it would be great if I had to go back, like take a degree in psychology and then go to dentistry, and maybe psychology, business, and dentistry. Or dentistry, it will really run you around into a successful individual, because you will understand the business, the psychology, the interactions with, right? And so I'm learning the business and the psychology by mistakes in the journey more than actual education.
That's interesting. That's really interesting. And then you touched on this about the issues kind of 10 years down the line. What other challenges do you see in orthodontics in the next 10? Oh, sorry, let me just go back again. So what changes do you see? I suppose it could be successful and unsuccessful, but what changes do you see happening within orthodontics in the next 10 years?
I think we are going through the significant impact now with clear aligners, and I would reflect back maybe to the 70s, when we went into the change from straight wire, like to straight wire, right? Or these journeys in which we think is the end of the world because this and that happened, right? We're going to survive. We're going to adapt. The question really is, each one of us will have a comfort zone about how much aligners we want to do, right? And it's just experience tells you that we're going to be fine, right? It's just that some do take that shock more deeply to themselves than others. I think aligners provide very interesting options for some cases that were difficult in the past. I personally don't see necessarily, I think it's another weapon that we have in our armamentarium to treat patients, right? And so it's and it's a lot of learning still to go, right? And for all of us to get better and improve into that. And so I think that that's going back into the future, really, is that journey for us as a profession, then to balance that advantages, disadvantages with aligners. I can tell you, what the way reflect is, those patients that don't use those class 2 elastics, it will be very difficult. They're going to use aligners. So anyway, everything that is compliance based,
Yes.
only 10% of the patients, that there's some research about that, only 10% of the patients are faithful users of orthodontic, every compliance. You have a 40% that will do to some degree and then they get tired, and there's a 50% that will not use it. So I'm kind of wondering then how much we expect a different journey, just because they are clear aligners into the process. Those complex malocclusions are not solved in 2-3 months. So after 1 year, I start seeing the patients just giving up about aligners, right? And then the results are not yet there.
It's interesting. I'm just thinking your two answers together about the psychology of human beings, and then now we're talking about compliance-based treatments as being going forwards when it comes to orthodontics, and how actually we still haven't, at least as a profession, married those two components together yet in the way to get a reliable clinical outcome. So you've told us about your journey and how you now have stationed yourself very much in Alberta in Canada. But I want to know who's been the most inspiring person to you, and who do you admire the most within orthodontics?
Well, it's my mentor. So when I moved from Peru to Canada, right, to do a 1-year postdoctoral fellowship, I had the chance to meet my mentor, Dr. Paul Mayer. And I am just fascinated to be under his wing for 20 years, and I still want to go for as long as he is at the school and university, right? And we are quite different personalities, actually, and then he's really strong in business, which I am not. But it's the fact that I can enter that room with something I think I know, and then a simple question directly, and then challenge me. I have to go back and then do it. So I like to be challenged. That's why I do research, right? There's questions, and I go back, and then I go back and try to come back to the answer. I come back to him, and then there's another question coming there and observing him. But then I observe him a lot of respect. At the same time, I don't. It's not a journey about trying to be that person. It's just a journey in which that person makes me better by challenging me, pushing my limits to be better in my journey, not to copycat him. And
Mm-hmm.
so, and he doesn't like to lecture, right? And it will be,
Yes.
he will do really, really good. He's a very, very good clinician, but it's about the, personal interest and everything. So that is the person I mostly admire, right? Because of the impact, professionally and personally in my life. It opened my doors for where I am now, and I'm always grateful for that.
That's interesting. So he's been someone who's got the best out of you, even though you're so contrasting personalities. And I think that isn't that just the most human story, is that you can't write it down on paper. Who would be the best person to get the most out of Carlos
Yeah.
Flores-Mir? But you've been fortunate to come across that, and that's really interesting. So I'm going to kind of bring the interview to a close on Carlos and just put it to you to give one piece of advice to all the other orthodontists who are out there. What would you tell them?
I think where I am now, I will basically go with how we started the conversation. So don't rush too much into how we want or we could move the teeth. Try to invest real time in try to understand what the patient wants, right? And because how many times we are happy with what we reach, but then the patient doesn't seem to be happy. The second thing I'm just teaching continuously is the informed consent is not a piece of paper that is signed and then it protects you thereafter. Actually, informed consent is the patient is giving you the consent to move the teeth. And what I'm learning and I'm teaching now is the concept that as soon as something is not working, and it could be not necessarily the treatment plan was wrong, but the biological response is not there, stop, have a conversation with the patient about what you observe, discuss the alternative to change the pathway. There's nothing wrong with it, document that. Don't wait until 24 months because that was your expected time, and then you tell the patient, by the way, this didn't work. So the more we do communicate and inform the journey, it's mutual beneficial for both. Because then when you tell the patient, remind them, what, this is a class 2. Remember we discussed that we may not be able to completely get the overjet or the teeth together. I don't think we're going to reach that. I think we are improving, but it's better for you to be prepared that this is not going to happen. Then at the end of the day, I finish with increased overjet. The patient normally will not come to make a comment. I am not satisfied with treatment. I'm preparing them for what's coming. So that will be my piece of advice now is then be open to talk with the patients about the things are not working well, right? And then just look into alternatives and respect the patient's wishes. But then if your professional opinion, we should change the pathway and the patient denies it or declines it, then it's a tricky place because you should not continue doing something that you are not think is going to work, right? And then terminate treatment, stop a treatment is always challenging. But it's no point to keep doing what you know is not going to work.
I think what I'm hearing, Carlos, and it's great advice that it's about having that conversation with our patients and the clinical journey and putting everybody into light as to what's transpiring. Carlos, thank you so much for agreeing to this interview for Orthodontics in Interview podcast. For the audience out there, please do subscribe and look forward to the next episode.
Thanks a lot, Farouk.
Just a few outtakes, guys, from today's episode. I hope you do enjoy it. Carlos, I'm thinking that you can help me out with a project that I've wanted to collaborate with somebody. I want to look at the effectiveness of podcasts. What do you think?
Well, Farouk, before doing a systematic review, we have to first figure out if there's some high quality evidence. And then from what I heard so far of your podcast, you're a long way from quality.
But okay, not systematic. Let's just do a case report, Carlos. How about you and me? We sit down, we get this case report about this podcast, incredible work that I'm doing. Let's just do this. Let's just do this as a case report. How about that?
Well, no, I think, I will just thank you for the interview, Farouk, but I think it's time to say goodbye.